Today I'm going to talk about HIV and AIDS. HIV affects 35 million people worldwide, and more than half of these people are in Africa. HIV is known as human immunodeficiency virus, and it is a retrovirus which affects CD4 plus T cells. Two forms exist: HIV-1, which is common worldwide, and HIV-2, which is rare and generally affects West Africa. HIV is a retrovirus belonging to a group of viruses known as lentiviruses. These are characterized by long incubation periods. What does HIV look like? Well, it is a round virus with two strands of single-stranded RNA. It is a retrovirus, and these by definition possess an enzyme called reverse transcriptase, which allows viral RNA to be transcribed into DNA and incorporated into the host cells. On its surface, HIV has a glycoprotein known as glycoprotein 120. This attaches to CD4 plus on the surface of T cells, macrophages, and dendritic cells. The CD4 plus normally serves as communication between cells. However, it is also very important in how HIV gets into cells. In order for HIV to get into cells, two things must occur. The glycoprotein 120 must bind to the CD4 plus on cell surfaces. Secondly, the glycoprotein 120 must also attach to the co-receptor. Common co-receptors include CXCR4, and both these things must happen for the HIV to get into the cells. So what happens to the body when a person gets infected with HIV? Patients can contract HIV through sharing needles, blood products, sexual contact, and vertical transmission from mother to baby, for example in birth or breastfeeding. Patients are initially asymptomatic, but seroconversion occurs after 2 to 6 weeks. This gives flu-like symptoms and can mimic flu or infectious mononucleosis. What happens in seroconversion? Well, a patient may have diarrhea, a sore throat, or enlarged lymph nodes. Antibodies to HIV may not be present at this stage, so it is best to test directly for the HIV antigen. This is known as the P24 antigen test. Also, HIV PCR can be done to test for the presence of HIV. So what is the treatment of HIV? Well, it should be started in a specialist HIV center, and everyone who has HIV should get access to antiretroviral therapy. The aim of this treatment is for patients to have a normal CD4 count and undetectable viral load. The treatment is divided into 3 categories. The patients can be treated with drugs which fall within these 3 categories. These include nucleoside reverse transcriptase inhibitors, protease inhibitors, or non-nucleoside reverse transcriptase inhibitors. It is recommended that in the treatment we use 2 nucleoside reverse transcriptase inhibitors and either a protease inhibitor or a non-nucleoside reverse transcriptase inhibitor. There's also other things that you should talk to patients about who have HIV, such as women who have HIV require yearly cervical screening. Also, patients should avoid live vaccines, and they should also be given cotrimoxazole if their CD4 count is below 200, and this prevents against a type of pneumonia which is common in HIV and AIDS sufferers. Also, some people will require prophylaxis after exposure to HIV, for example a needle stick injury. This is not 100% effective, but it should be started within 72 hours of contact, and the treatment should continue for 28 days. Then the person should be retested in 12 weeks for any signs of HIV. What is AIDS? Often people get mixed up between HIV and AIDS, and AIDS refers to a condition when the CD4 count is below 200 and or opportunistic infections occur. And HIV is the last stage, or AIDS is the last stage of HIV, and hopefully now in the modern day and age we should see less people progressing to AIDS due to effective treatment. But when AIDS occurs, the body is more vulnerable to a variety of different infections. For example, a patient may be infected by toxoplasmosis, which causes neurological symptoms such as a headache and fever, and they also may be prone to things like CNS lymphoma. And a particular thing that is common in the skin is Kaposi's sarcoma, which is caused by human herpes virus 8, and it causes purple macules or papules on the skin, typically the face, and can also affect the respiratory system, causing a patient to cough up blood. And patients with AIDS are also susceptible to tuberculosis infections, amongst many more, and candidiasis of the throat. Normally people may get candidiasis in the mouth, but HIV and AIDS sufferers, particularly AIDS sufferers, will get candidiasis within the throat. So thank you very much for listening. This concludes my video. If you enjoyed it, please don't forget to like and subscribe for more medical educational videos.